Good morning, everybody. I'm Muriel Bowser. I'm the mayor of Washington, D.C., and I'm here today to provide the district's daily briefing on our response in Washington, D.C. to COVID-19. I'm joined by members of D.C. government, including our public health team, and also members of the Council of the District of Columbia, the chairman of the council, Phil Mendelson, the chair pro tem, Kenya McDuffie, and at-large council member, Alyssa Silverman. As you know, we report each night on positive cases, and last night we reported 48 new positive cases, bringing the district's total number of people testing positive to 231. Sadly, we also announced a third death related to COVID-19, and we continue to send prayers to the families of those who are affected by this virus. Late last night, we also shared that a resident in the custody of the Department of Corrections has tested positive for COVID-19, and he is currently in isolation in the infirmary and being monitored. We continue to take extraordinary steps to protect the health and safety of all residents. You likely got an alert last night on your phone reminding you to stay home, reminding you that all essential business in the non-essential business in the district has been prohibited. As we focus on our response to COVID-19, we're also focused on our eventual recovery framework as well. Last night, the Senate passed its Phase 3 coronavirus relief package, in which D.C. is treated like a federal territory. D.C. is not a territory. This means, according to their treatment, that the district will only receive $500 million, while every other state will receive a direct payment of at least $1.25 billion. And that's a difference of $725 million. This makes it even more critical that every D.C. resident complete their census. It's live right now on the 2020 census.gov, and it can be completed easily from a mobile device, and it takes less than 10 minutes. I have to say that the very idea of being treated like a territory is shocking, it's infuriating, it's wrong, it's outrageous. We're not a territory. We pay more taxes, unlike the territories, than 22 states. We have a larger population than several states, and we are treated as a state by thousands of federal laws and programs. It's unconscionable to give D.C. the least amount of funding of any state, especially given the unique challenges we take on as the seat of the federal government. Yesterday, with the council, I sent a letter to Senate leadership calling on the Senate to right this wrong. I want to thank Chairman Mendelson and his entire team for combing through these proposals and calling out this injustice. I also want to thank Senator Chris Van Hollen for taking to the Senate floor, working with us when we learned of this injustice, and calling out that injustice and the harm it will cause our residents, our doctors, nurses, first responders, frontline workers, federal workers, Senate staffers, senators, congresspeople, and everybody who lives and works in Washington, D.C. So we're going to keep doing what we need to do locally. We're going to keep calling on the White House to step up on the procurement of life-saving supplies. And now we will be working to fix whatever disadvantages this relief package brings to the residents of Washington, D.C. I'll turn to Chairman Mendelson, and then we will be available for any other questions.
Thank you, Mayor Bowser, and thank you all for being here. And I want to again acknowledge colleagues who are here with me, the Chair Pro Tem Ward 5 Councilmember Kenya McDuffie and at-large Councilmember Alyssa Silverman. I'm going to speak a little bit more to what the mayor spoke to with regard to the relief bill going through Congress. It was approved by the Senate last night. We became aware yesterday afternoon when the document was first released how the district was being treated. And while I agree with everything that the mayor said, at the risk of being perhaps a little bit politically incorrect, I'm going to say that this issue, I believe, is not about statehood, but about public health and about the economy. The district, as you know, is seeing the effects of this pandemic, seeing these effects very much. And we are working with our neighbors, that is the states of Virginia and Maryland, but we are not able to stand side by side with them when they are getting at least $1.25 billion and we are getting somewhere, I want to say about a third of that. I guess it's a little bit more, but substantially less than what they are getting. And yet we are trying to move in lockstep with Maryland and Virginia with regard to the public health response. This is about public health. It's about our economy. As a denser jurisdiction, denser than states with large rural areas, we are seeing a greater impact of this virus. Look at the New York City region, a very dense region, which right now is ground zero in the United States. We don't want to be like New York City in terms of the New York City region, in terms of the public health effect of this pandemic, which is why the funding is so important. It is important for public health reasons. It is important for economic reasons. As you know, the district relies on businesses such as tourism and the hospitality industry, which are disproportionately affected by this shutdown. It disproportionately affects us more than other states that are not as dependent on hospitality or tourism, which is why this economic relief from the Congress needs to be equal, at least equal, to what the states are receiving. If you think about it, it makes no sense, and I mean no criticism here, that states like Wyoming or Vermont would get more money than us when the pandemic is clearly far more of an issue and a public health threat here than it is in those states. I'm hopeful, we are hopeful, that the Congress will rectify this shortfall, because this affects people. Again, this is not simply a statehood issue. This is a public health and an economic issue. And we are seeing people suffer economically. We are seeing people suffer in terms of this pandemic, which is why the Senate and the House need to recognize greater relief for the District of Columbia. I again want to thank the mayor and all of my colleagues. We worked together on this letter that we were able to get out with just a couple hours notice, because, like you, we were unaware of this, what the relief was going to look like, until yesterday afternoon. Thank you.
Questions? Yes, sir.
So, in regards to the 15 million that you announced going toward the ventilators, some clarification around that. Did that come out of not the surplus?
We drew down on our contingency funds. Those are funds that we pay back. They're funds that aren't budgeted in our normal budgeted process, but we can use for unforeseen expenses like this in the entire response to the coronavirus pandemic.
As a follow-up, how much, given whatever happens in the Senate, if they don't follow through, how much of that do you expect? How much more of that do you expect to dip into?
How much more? For the pandemic response, we don't know all of the costs that will be associated with the pandemic at this point, but we're going to spend what we need to keep residents of the district safe. Yes.
Have you spoken to Speaker Pelosi personally? Do you have any hope that, as Chairman Middleton alluded to, that possibly the House might correct this in D.C.?
I spoke to Speaker Pelosi at the onset of this pandemic when we were talking more about how what she would do with keeping the Capitol open. I think at that time we had some very preliminary discussion about what they would be working on in terms of relief. But specific to the bill and what's happened, I haven't had a chance to talk to her yet. Our Congresswoman, who I spoke with last night, had been in direct contact with either the Speaker or her office. And others have indicated to me that it's unlikely that there will be a lot of changes for this round at the House. But the expectation is, and the Congresswoman wanted me to express this on her behalf, that she would be working on the next round to make sure that it's fixed. Yes.
So is this just a result of not having anybody at the table? Is that your thought, or what are your thoughts there?
Every state that has 2 senators was treated the exact same. We don't have 2 senators. And it matters not having 2 senators. And that's why we have pushed so hard for statehood so that we would have 2 senators. But more than that, to Chairman Mendelson's point, which there will be a lot of intrigue behind whose motives got us to this point. But for everything, we're treated like a state when it comes to federal funding formulas. For everything. For housing, for Medicaid, for education, everything. We're treated like a state because we have state functions, as we should be. And we pay taxes, more taxes than 22 states. So we'll get to the bottom of how they ended up treating us like a territory. I really can't think of another occasion that we're treated like a territory. So there's something there that we'll figure out. But right now, all we have to do is focus on how for the next round of funding that this $725 million gap is made up. And we're going to work with our Congresswoman, with all of our elected officials, in making sure we have a strategy to do that, including our regional delegation. I have to say, when I called Senator Van Hollen, he immediately got back to us. He went to the Senate floor to speak up for us. He put a courtesy hold on the bill to make sure he got a response from Schumer's office. And you heard what he said. It's not an oversight, but this was a negotiated point, and we'll get to the bottom of it. Yes.
Question for Dr. Nesbitt.
Yes.
We're hearing more and more about young people being infected. I believe we have some babies in the district. Can she enlighten us on how they're doing, how they got sick, and the vulnerability of young people to this virus and disease?
There's still a lot that we're learning about the impact of COVID-19 on various age groups and populations. Right now, about 4% of our cases have been in individuals less than 18. Those individuals, based on what we know so far, have had close contact with other individuals, primarily individuals within their own households.
Babies more vulnerable because of their...
It is premature for us to be able to make any definitive statements around what is happening with children in the U.S. and in particular in the district. We won't be making any comments or providing any definitive statements around any of the particular cases.
Another question for Mayor Bowser. We understand that there are some quote-unquote non-essential businesses that are still open, whether there's a language issue or they didn't get the word. Is there any enforcement that's going to begin to try to bring them into compliance?
Yes, there will be. And so we are inviting, if any resident wants to make us aware of that, please call 311 and let us know. And we will continue, and I appreciate you noting that, because we think businesses will be compliant. And if they didn't get the word, they don't have the right information, we're going to make sure they get it. Yes. I think the message speaks for itself. It says stay home, and it tells people that non-essential business in the district is prohibited. And that's all I have to say. Yep.
What's your message to members of Congress and their staff members who live in the house in the city, who eat the city, who might go to hospital in the city, about how the shortfall in relief funding would affect them?
Well, you've heard from the chairman already that we just need to be treated fairly. We're not asking for special treatment. We want everything that every tax-paying American is getting out of this relief bill, and this bill is meant to help states respond to the health emergency and the recovery. And everybody who lives and works here has a stake in that and should be offended and outraged by any politics preventing the fair distribution of American dollars to help Americans.
Mayor Bowser, in terms of protective gear for firefighters, police, can you give us an update on where that stands for those who are concerned as they go into areas, particularly firefighters as your very first responders?
We have, when we think that we got a good enough start in procuring those type of protective gear and supplies for our first responders and medical providers that work for district government. So we feel like we're in a pretty good space with that. We continue to procure those items in the event that we have a medical surge and need to function as a central place for supplies for some of our medical providers. So we're still actively buying supplies.
Be protected as best they can, obviously.
Obviously, yes.
Online learning, I guess, has started. What is the timeline for having computers and Wi-Fi for the young people who need them? I guess.
We're working as fast and hard as we can on that, Sam. I think you heard my report yesterday that the chancellor is devising a priority plan for getting the devices that we have on hand out, and he will make some announcements about that as they are ready. We're still working to try to procure these Wi-Fi hotspots, and we're working on that as fast as we can. Yes.
For the DC jail, how many inmates have been tested, and how many inmates are coming into the jail, or people who maybe aren't convicted yet but are coming in? I understand you still have to arrest people. Just to start.
Well, we have to arrest people who commit crimes, and the crime business is still happening. So yes, we do have to arrest people. But I was briefed by Kevin and my public safety team about some strategies that not only DC Jail has put in place, but the U.S. Attorney, MPD, and the DC Court. So I'm going to ask Kevin to address that and talk a little bit more specifically about the jail.
Sure. So let me just first say we did have, as the mayor said, one resident in the custody of the DC jail who tested positive. There is, as of yesterday evening, 36 inmates who will be put in quarantine per protocol from DC Health, and testing is done according to the guidelines provided by DC Health. So to the question of the number of individuals coming into the jail, as the mayor stated, each body's playing its part. So MPD has changed they have more robust use of what they call citation in lieu of arrest. And the U.S. Attorney is making their decisions whether to prosecute much earlier before any individuals even reach the central cell block. So as a result of those two activities, the inflow into DOC custody the past few days has been reduced by more than 50%, and in some days as much as 75%. So we're seeing a dramatic effect from the changes MPD has made and the U.S. Attorney have made. Now, if you commit a violent crime, if you have an illegal gun, they will still arrest you and you will go through the justice process. Domestic violence allegations will all be sent and arraigned as they normally would. The Superior Court on Sunday, the Chief Judge issued an order that, guidelines I should say, that allows for attorneys for individuals in DOC custody under the Superior Court's jurisdiction to petition for release, and he gave guidance around what those qualities are that include the age of the person, underlying health conditions, and that provides an opportunity for individuals at the DC jail through a judge's order to be released if the judge deems that that individual fits the criteria established by DC Court. And finally, at the DC jail, the council legislation expanded the impact of programming, so what's called good time credits. So as people take programming in sort of with guidelines established by DC Health for social distancing, they'll have a better opportunity to get credits that will allow for them to get out early. And I should say DC Health has had a pandemic plan. They've had a plan for COVID-19 for staff or an inmate for weeks now, and they're activating that plan as of 10:30 last night. What's that?
Suppose they have COVID-19 and you're releasing them.
Any individual with COVID-19 who is subject to release or is bound to release will, Unity Healthcare is at the DC jail. Unity Healthcare has access to both private testing labs and our public health lab to be able to test individuals and get feedback from that test same day. They do health checks of inmates as they come into the jail, and they do health checks routinely when they're at the jail. In a context for those, our jail is almost half empty. So because of the capacity at our jail relative to the population, the DC jail has in their COVID plan the ability to space people out that probably does not exist in many other facilities around the country.
One, you said you're testing inmates when they come out. You're testing them periodically while they're in custody. Or not test them, but you give them a medical whatever. You screen them. Thank you. Do you do that before they're released, upon their release as well, before they step out of the jail?
I'd want to talk to the DC jail about Unity Healthcare's health screening upon exit to get you an accurate answer.
And then one more question. Back to the DC courts, the chief judge had said in that release that the court system was overwhelmed, was his exact words, with the number of motions to have for relief, to have prisoners released. Do you know how many prisoners have been released because of those motions?
I would want the courts to speak to that because it's their process. We are facilitating it and are cooperating with anything the courts ask of us.
The jails that have capacity now, could you tell us how many inmates have been released in the past week for whatever reason?
I'd have to get that answer for you later on.
Can you also elaborate on the pandemic plan and what kind of precautions are being taken since the positive test?
Sure. So the DC jail has two buildings, the CDF, the detention facility, and the CTF, which is the treatment facility. At both institutions, they have a number of essentially empty cell blocks. And those empty cell blocks in both buildings have been able to be converted into areas where individuals would have to be quarantined, inmates who have to get quarantined would be able to have their own cell and have a services that take into account that they have to socially distance. So everything from how food is provided to the level of programming that is facilitated. So so when the 36 individuals who have to quarantine as a result of this one positive case, those individuals now move into one of those quarantine cell blocks, which is essentially an empty cell block that allows for them to have appropriate social distancing. They also have PPE equipment for staff who are now interacting with individuals in that quarantined areas to be able to have protective equipment so they can safely do so. Just around 1,700.
I covered a homicide in front of Southwest Safeway yesterday, and I understand there was at least another one. Any indication that the crime situation here is changing with this virus?
It's
situation?
too early to tell, but the fact that we had 2 homicides by gun yesterday is a sober recognition that individuals who carry weapons have not been dissuaded thus far from using them. If a few more weeks go by, we'd have enough information to know between violent and property crimes if there's an impact from as a result of change in behavior. But our gun crime in particular remains unchanged. Other types of crime shows early signs of changing, but gun crime is not.
When you say changing, declining, or going up?
Our gun crime is still at the same level it was prior to the COVID coming here, and we're looking at every crime category, particularly concerns about crimes between neighbors or domestic violence, to see if that changed. It's too early to tell at this point if there's an impact on those areas.
Mayor Bowser,
Yes.
when you look at the charts and the health officials are telling us that the trend is it's only going to get worse initially before it gets better. When some in the federal government, in the national government, are saying let's get things back to normal or start easing back by mid-April, Easter time, what's your reaction to that?
My reaction is that we're going to follow the science and see what our Department of Health is advising. We have a public health emergency in effect until April the 24th. And at some point, we'll evaluate what the level of infection is. Is it increasing? Is it decreasing? Is it at zero? And we will make some determinations about if that emergency needs to be extended.
Mayor Bowser, very candid about the pressures fiscally on the government during this time. And on social media, whenever I tweet about, you not giving relief, for instance, not extending the property tax, a lot of the social media comes back that relax, DC makes plenty on parking tickets, on speed cameras, and there's this, at least some sense out there in social media that the district is flush with this red light camera and speed camera money and doesn't need this extra stimulus from the federal government. What would you say to those people who have that knee-jerk reaction?
I would hope that they're being flip or not really spending a lot of time thinking about what they're saying, because all you have to do is think about your own finances. And if you all of a sudden, and many people in our city are in this position, have only a fraction of your revenues coming in, you simply cannot do the same things that you always did. Even if you have reserves to be used, those reserves quickly disappear if you're not collecting one of your main sources of revenue. The district relies on revenues from taxes, from income taxes, from property taxes, and from sales taxes. We have prohibited non-essential business, bars and restaurants, theaters, entertainment hotels from operating in our city for 2 weeks. And we have at least another 4 weeks to go. So all of those revenues that would come to the city in the form of taxes to take care of basic city services has disappeared. So we have to pay our firefighters, we have to pay our police officers, the people who are doing all of our unemployment processing. We have even cobbled together local relief for our small businesses in a small amount. But the basic functions of city government have to continue. And the only way that we are able to do that is with the revenues that we have coming in. So the property tax is one of, and I'll turn to the chairman of the council to talk about this as well, but the property tax is one of our biggest sources of income. And that property tax is paid it's paid twice a year, but the first time of the year is around now. If we were not able to collect those property taxes, we may not be able to meet the obligations of the government in very short order. So that is why we are very focused on managing, and we're in a good position to do it in DC. But we have to manage what we have coming in so that we can take care of our basic operations of government and be in a position to move our city forward when we get on the other side of this.
I would add to that what the council was told last week by the chief financial officer was that if this shutdown continues until June, that preliminarily the estimate is about $500 million in lost revenue. $500 million in lost revenue. That is substantial. And it raises a concern about liquidity issues, whether the district will have enough cash, because during the summer, typically, we reach what's called a cash trough. And we may be getting revenues enough for the year, but in the summer the revenues are at their lowest, and yet we still have to go on with all of the operating expenses. So there's a liquidity issue as well as a lost revenue issue. If we deferred the property tax, if I remember correctly what the chief financial officer told me earlier this week, If we defer the property tax receipts are roughly equivalent to the total of our rainy day funds. So there is a real liquidity issue. We are trying to provide as much relief as we can, and yet at the same time, it reminds me of the metaphor about on the airplane when the oxygen mask comes down, that we have to take care of ourselves as well as take care of our citizenry. We have to do both. And so we have to be mindful whether we have the liquidity, we have to be mindful that our revenues have dropped dramatically. I'll remind you of one other thing. What we learned this morning was that the highest unemployment in this country was in 1982, about 700,000 people filings in one report. Today what was released was 3.2 million, substantially more. We are seeing an economic impact that is substantially greater than we have ever seen before. It's the District of Columbia, it is Maryland, Virginia, it is the country.
So Chairman, can I just ask then, why then did the council carve out hotels and give them a break on property taxes and no other industry, no other business, no other resident? Why did hotels get this deferment?
The question had to do with why hotels got a property tax relief, why the council did that. They got property tax relief and not sales tax relief. All other retailers got sales tax relief and not property tax relief. And then the independent contractors and the businesses that don't collect sales tax got no relief, except that we have that $25 million small business relief. And we will continue to look at what the district is able to do, what the impact is, and what the federal relief is. You know, the federal stimulus is about stimulating the economy as well as helping the health sector. Stimulating the economy, and that is why I was so forceful earlier, why all the council members signed this letter, why the mayor spoke to this and has been very active on this, that the relief to the district from the federal government is far less. This is an economic issue. But when we see what the economic impact is, when we better understand what the financial hit is to the district, when we better understand what the what relief is available for businesses and individuals, then we'll be able to come back and see what additional help we can provide to businesses and to residents.
Okay, I'm going to take a
Chairman.
couple more. And go,
Chairman Mendelson or Mayor Bowser, in practical terms, with how we're being considered here in the district, when the time comes to issue the checks and people are hearing $1,200 or this or that, is it the case that perhaps people who live in the district will get much less of a check than people over in Virginia, Maryland, and the rest of the country?
I believe that the checks from the federal government under the relief package is separate from the aid to the states. So the checks to individuals will depend upon their income, and again, I believe that is separate. But this was not said earlier. Each state will receive a minimum of $1.25 billion. It's based on population, so some states will get more. But then in addition, we believe, as best we could understand the legislation yesterday, cities will get additional. And so the district is just one unitary entity, but there will be states where they probably will be getting additional for the cities and we will not.
Okay, yes.
Is there a point past which you believe you will have to issue a shelter-in-place order? What's holding you back from issuing that order?
Next question. I answered that earlier.
Is the city making any attempts to increase staffing on the unemployment hotlines?
I mentioned that yesterday, that we were able to procure a call center, and I believe that they have started either today or they will start this week.
Do you know how many more people are able to take calls now?
22.
That's additional. And then has the city planning on reaching out to Events DC for medical surge capacity?
We have on the Army Corps of Engineers reported, I guess it was 2 days ago, and they're doing some site visits across the district about for medium to larger scale facilities that we could use in the event, and they have visited the convention center for a site visit.
What about Armory Hospital?
Yes.
And the Armory, perhaps?
Perhaps. I don't know the whole list of places that they visited. Yes.
Mayor, have you been following the events at Hope Village? I know it's a federal facility, but it's in the city. Supposedly inadequate supplies for the people who are confined there.
I'll turn to Kevin. Actually, in our briefing yesterday, we have a Corrections Information Council that has inspectors that can go to all the federal facilities, and we are dispatching those inspectors so that we clearly know what's happening there. There have been some changes at Hope Village in terms of people having visitors and people being able to come and go as an effort to contain the virus and not have the virus come into the facility. So I know that there's a lot of frustration on the part of the people who are living there right now.
What will the inspectors be looking at?
For supplies and conditions, and to make sure that everything is the way it's supposed to be.
They are on the way there or there? Or?
We talked about this yesterday, so the inspections may have already happened, but I don't have the report yet.
Limited to DC residents or open to non-residents too?
I think our expectation will be it's for DC residents, but they're still working on all of those logistics.
Do we know where the George Washington University testing site will be located? The one that's not going to be.
It'll be close to the hospital. I don't know exactly the location, but I think they're trying to site it near the hospital.
While we're here, we have one camera frame. Can we ask Ms. Silverman a question? Maybe Mr. McDuffie afterward.
Sure.
Since
What's
you're
your
here.
question?
Just your reaction to the crisis, how your constituents are handling it, how the businesses, how the people, just from your life experience, what you're seeing. 3 weeks ago, nobody had a clue that this was going to be what we were dealing with.
Sure, Bob. Well, we've all been impacted. You know, some of our residents have been impacted in major ways. They're losing their employment. Their businesses have been mandated to close. I think it can't be stressed enough that the impact is on every one of us and on the city as a whole. As chair of the Labor and Workforce Development Committee, we have been working with DOES on helping our workers who have lost their income now, have lost their jobs. It can't be stressed enough, the chairman said it earlier, but the number of claims that we are seeing is unprecedented. Throughout the country, as the chairman said, there are unemployment numbers that came out today. 3.2 million people have filed a claim for unemployment in the last week. The mayor puts out statistics every day. I think we have topped 25,000 since the public health emergency order was issued on March 13th. It is a hard time. It's a difficult time for our city. I want to thank those who are working at DOES, especially. They are working overtime, and I know there have been a lot of issues. I guess, if you don't mind, Madam Mayor, I'll just say I know that people have contacted the administration. They've contacted my committee about getting denial messages. Once again, the administration is working as hard as possible to upgrade the system to reflect the changes that the council made in the emergency. But again, to our residents who have gotten denials because of the job search issue, you should put no for job search. You will still have your claim processed. But I think I will just say, Bob, that we know it is hard to hear about taxes and all these issues because we know that our residents are hurting. We know that your income is evaporated. I think that the issue that the mayor and the chairman have stressed is that the city is experiencing the same thing as a whole. One thing our chief financial officer said is that because our hospitality industry has been shut down, we are losing, I think, 30 to 50% of our sales tax revenue just from that industry alone. And another point, I want to thank the chairman and the mayor for talking to Congress and sending the letter. It doesn't just impact us. Unemployment is filed in the place where you work. So I haven't looked at the bill, but if the being considered a territory means that we're going to receive less unemployment, that is impacting Maryland and Virginia residents because you are filing, a lot of people in suburban Maryland and Northern Virginia work in the district. We're an employment center for this entire region, and you file unemployment with us, not with your home state if you work here. So this is a regional issue, and that's why it's so outrageous.
Okay. Thank you, everybody. Thank you very much.
fact, they just called me. Apparently, we didn't even get the first 5 minutes of it. They just,
Oh, you in the picture?
We'll come. Are you guys parked out?
he's right here.